The diagnosis journey for Mcas and histamine intolerance patients can look a little different for everybody. And unfortunately, from what I've understood and my own personal experience, the average, and hopefully this changes, but the average for diagnosis is, for at least for Mcas, it's 10 years. And that sucks. Took me 15. Things I can recommend, steps I can recommend for you to take to try and help your husband get a diagnosis faster, much faster than even years from now, include a few things. Number one, know that skin testing can be extremely dangerous for mast cell activation patients, and blood testing is actually what is recommended. The reason being is that even if you do not show a true allergy to any of the foods or chemicals or allergens that are presented during a skin prick test, it can still result in a dangerous reaction for a mast cell or histamine intolerance patient. Now, mast cell is different than histamine intolerance in that, from my experience, mast cell is tied to faster, more severe reactions. I can tell you within 1 or 2 drinks of something that's high in histamine, or 1 or 2 bites of something that's going to set off histamine response, that I'm in trouble and that I need to take rescue meds. My anaphylaxis symptoms start, and I'm aware of what they are now. Histamine intolerance can take a few hours to a few days to react to a combination of foods and or stressors, because in histamine intolerance, your histamine bucket, your threshold for what your body can handle, is already at its peak, and that because of that, it's not until you add enough stressors that histamines are actually overflowing in your bloodstream that you get a reaction, which sometimes makes it really hard to tie what actually triggered the reaction. Things you can do to help your doctor help you get a diagnosis: record and document every reaction, video, pictures, notes. You can serve as a witness and document your own observations of your husband's reactions. You can go with him to the appointments, and you can serve as an unofficial patient advocate in telling the doctor, yes, this is what I've seen, this is how he reacts. Also know that they're probably going to say that it's time for tryptase testing, and tryptase testing only shows abnormal tryptase levels in 30% of mast cell patients. The rest should be diagnosed clinically, and that doesn't always happen.